Hello, welcome to the StellaLife Innovator Series. I'm Liz Lundry, and today I have the pleasure of talking to Dr. Drew Rossi. Dr. Rossi trained in periodontics at the University of Texas Health Science Center in Houston, receiving his Master's of Dental Science in Periodontics and completing a one-year fellowship from the International Congress of Oral Implantologists. Dr. Rossi, who serves as a part-time dental professor at his alma mater, has specialized in periodontics since 2014. He's an expert in regenerative periodontal therapy and soft and hard tissue reconstruction and performs private practice clinical research at his office, Perio Health Professionals in Houston, which is an FDA-supported research center and the flagship of the McGuire Institute, performing more clinical research than any other office in the country. Welcome, Dr. Rossi.
Great. Thanks for having me, Liz.
Yeah, thank you for your time. Your practice is a very progressive perio office. What is your practice philosophy and what types of procedures do you provide in addition to traditional periodontal surgeries?
Yeah, so our philosophy is that everything we do is backed in some type of research and education. Periodontists, we tend to use that philosophy just in general with our traditional perio. But with that being said, we end up doing a lot of kind of innovative procedures, such as microsurgery. We do a lot of laser therapy as well. And as you mentioned before, we're kind of on the cutting edge of the newest products that are around. So we spend a good amount of time just doing that. But I'd say, most of my practice is still traditional perio, doing, disease control and doing soft tissue. It's the fun little research projects, maybe 10 to 15%, that make it really, really interesting.
Yeah, and you do facial aesthetics as well in your practice, which with the PRF, which is
We
really
do.
amazing. Yeah, your patients must love that.
Yeah, we do. It's a good little value add as well. We've known for a long time that PRF and using autologous growth factors is pretty much the gold standard for soft tissue reconstruction in the mouth, and it helps a lot with hard tissue. It's just kind of a natural progression to start using it in the perioral space. If a patient's going to spend all the time, effort, and money in redoing their smile, redoing their bite, a lot of times they want the area around it looking good too. So it was a natural thing.
Yeah, yeah, absolutely. Get that smile and all the curtain, the stage, everything that
Exactly. The
yeah,
frame looks really, really good around the photo.
absolutely. So, Perio Health Professionals has a research department, and you've conducted numerous studies, including a study about AI, studies about different techniques, materials, and technologies. Please share what you've been doing with that.
Yeah, we do. So, as you kind of mentioned before, in my bio, we are the flagship of the McGuire Institute. My partner and mentor, Dr. Mike McGuire, started doing research back in the 80s. And, at this point, we've developed a network of 16 offices around the country. I think there's now 25 investigators. And what companies will do is they'll come to us with a new product or a procedure. We'll design a trial around it. And, we'll usually do the pilot here at Perio Health, but then utilizing the whole network around the country, we'll go and implement that. And what's great about that is it's real world data. These are our private practice patients who are the patients that dentists are seeing every single day, which is certainly different than our dental school patients that we're seeing. Most universities don't have real world patients coming out of there. And now the FDA and other organizations are putting a lot more value on that, as well as these patient related outcomes. So right now, we've got an AI study that's going on. We're just finishing up a study with Dentsply, looking at their new implants. We're in talks with several other companies looking at soft tissue products as well.
Yeah, no, it's having the real world patients there, like you're saying, it puts a whole different perspective on that. I always say there's research and then there's reality, and you're
Yeah,
kind of combining both, you know.
exactly.
That's pretty awesome. And I know you add StellaLife to the mix there when you see your patients. So we appreciate you doing that and helping them have a better experience too. So you're honestly going on improving people's lives on so many different levels. And given how much support you're giving so many different people, you are also in the process of creating an educational initiative program. So you're creating learning modules to train auxiliaries such as assistants and hygienists. So please tell us about that.
Yeah, so I've worked all over the place before I joined my partners. I've worked in the DSO space, I've worked in the private practice space, but not until we kind of came to when I came to our office did I see the amazing training that our assistants and our hygienists had actually received. So that really just inspired us. Our dental assistants, they're true surgical assistants, OR capable assistants who really know four-handed dentistry, who really know sterile technique, and who really help us be as productive as we are. Our hygienists as well. We started allowing them to do a little bit more expanded duty things, such as you using endoscopes to help during scaling and root planning as well. We do laser therapy as well. They'll end up doing that, and to kind of show how we've trained people. We're starting a school so that people will get certifications to go out to other practices as well.
That is awesome. As a hygienist myself, being able to use endoscopy and all that, that's wonderful. And now they're going to be able to also provide local anesthetic. So
Texas is the 49th state. Took us a little while, but now we're going to finally be able to actually do anesthesia. So that'll be super helpful with our SRPs and with our other procedures we do in the perio office. But also their expanded duties with utilization of a laser too.
great. Yes, as a consultant, I do have doctors and offices I work with in Texas. And so I want to say thank you, Texas, and allowing the hygienists to really use the full spectrum of their abilities, really in service of our patients. So that's what it's all about. And that's what you're
Absolutely.
doing with all that you offer on so many levels. So Dr. Rossi, thank you so much for your time today. Keep up the good work. And I was looking at some of those studies. I'm really looking forward to seeing your work of the future. Thank you.
Yeah, thanks so much, Liz.
Thank you everyone for joining us today. Please join us next time at our another Innovators series, and also stay well and stay happy. Thank you all.